Welcome to VidZette's podcast. I'm Dr. Ted Noel. Back when Barack Obama was advertising the wonders of Obamacare, he said, if you like your doctor, you can keep him. If you like your health plan, you can keep it. Well, it may be that things really didn't turn out so well. This week in the Federalist, we have an article by a couple who are both over 60 years old. Now, before Obamacare, they had employer insurance. Since then, they haven't had it. Why? Because it was too expensive for the employer. But, back then, they were paying $4,600 a year for their insurance. No big deal. Over the 3 years, now we've gotten to the point where if they were going to try to buy the same insurance they had then, it would cost them $22,000 a year. That's over 4 times as much. It's almost 5 times as much money. Now, that's insane. But let's look at what's really happened to them. Because they don't have employer insurance anymore, they do have to buy their own. And the premiums that were $4,600, well, they had to go down to a lower level plan in Obamacare, but still they're paying $15,000 a year. That's triple what they were before. That's a 225% increase in premiums. They were paying $4,600. It's gone up $10,400. Where are they going to get that money? Oh, and by the way, the deductible that they had when they had employer's insurance was $3,500. Now, that's not a whole lot of money, but now it's $11,500 higher. They have to pay $15,000 out of pocket before their insurance pays a penny. Now, we have to ask, is that insurance? Now, if you recall some of our discussions before, if we only had high deductible insurance, you could buy that high deductible part, let's say after a big deductible of $5,000 or $10,000, for a few $100s a year, maybe $1,000 or $2,000 at most. But this is $15,000 premium before you shell out $15,000 of deductible, before Obamacare shells out a penny. And you go, that's insane. Why did all of that happen? Well, it's a little outside of our discussion, but remember, these people over 60, they have to buy insurance for maternity coverage. You want to run the list? There's a whole bunch of things they have to buy insurance for that they will never have a need for. But, hey, that's who it is. Everybody has to pay for everything. So these people have to pay way too much money. Now, in order to make up the $22,000 increase in after-tax out-of-pocket money, they'd have to earn at least $30,000 a year more. Now, I don't know anybody who can just walk up and say, I want $30,000 a year more in salary. It can't happen. So they are left with insurance that just is not insurance. It's a bad joke, and it empties their wallet. Who's getting all of that money? It's going to the insurance companies. It's going to doctors. It's going to hospitals, and so on. These people aren't getting any benefit from theirs unless they really, really get sick. That's not the way insurance is supposed to work. Of course, the Ryan Care plan that failed in the House didn't do a whole lot for them because it didn't change the insurance company mandates. That is, you have to buy insurance for all of these different things, most of which you're never going to use, in order to get insurance at all. Ryan Care didn't change that, which meant it did nothing for your premiums. Now, as we look again in the Federalist, we see a new article looking at all of that money that's being spent on Obamacare. Now, if we back up for a minute and look at what Obama said it would cost. The advertised price was $850 billion for 10 years. We now know that he lied. Should I be surprised? In any case, the real cost is not $850 billion. It's $2 trillion or more. That's an insane amount of money. I mean, back when I was a kid, I remember Everett Dirksen, senator from Illinois, saying $1 billion here, $1 billion there. Pretty soon you're talking real money. You could do $1 billion here, $1 billion there, and never get to $1 trillion. That's huge money. But the question is, suppose we spend it all on care. It turns out that it costs around $5.5 billion to build a hospital, staff it, and run it for 10 years. That is a 500-bed hospital. That's about what it costs. Well, if we took $550 billion out of that $2 trillion, that's just over a quarter of it. We could add 2 new 500-bed hospitals in every state and run them for 10 years. That's direct patient care. That's money going directly to help people. And if we then decided that we want to do let's say we did a little more. Not everybody needs to go to the hospital. You know, you got people who we could go to Doc in a Box and, you know, an urgent care clinic, or, you know, there are some lesser things that people need to have done and routine checkups and whatnot. So let's suppose that we built a bunch of clinics. You know, like right now your county charity clinic that's run by Medicaid, or in my town we have something called Shepherd's Hope, which is run by the Catholic Church. Any one of these kinds of clinics where people could come and get seen. For $300 billion, remember, that's just a little bit more than half of the cost of the hospitals. So we take $550 billion for hospitals, $300 billion for clinics. That's the $850 billion of advertised price for Obamacare. We could build, count them, wait for it, we could build 20. That's every finger and every toe. 20 clinics in every congressional district. Let me run that by you again. 20 clinics. Staff them and run them for 10 years for $300 billion. Well, think about all the people who could go to those. There'd be a lot more people that would be tended to. Now, let's back up and talk about the number of people we want to tend to. The hospitals would serve about 15 million people. Okay, not bad. For the clinics, we would take care of 70 million. That's a total of 85 million people served. McDonald's would be proud. 85 million served in 10 years. How many years did it take them to get to 1 billion? A long time. So let's look. If we look at the 85 million that are served and compare it to Obamacare. Obamacare claims 20 million people new are covered. I'm sorry. Drum roll, please. Da-da-da-da-da-da-da. That's a lie. We've talked about it before. 20 million is the advertised number, of which 13 million are new Medicaid patients. They're not even Obamacare. Of the remaining 7 million, more or less, about 5 million of those are people like the people in our first article who lost their employer coverage and had to go to Obamacare. That leaves us with a little over 2 million people who are new, truly new coverage under Obamacare. 2 million. And that's when we're spending $2 trillion. That is $1 million per new person covered. You heard me right. It is 1,000,000 times 1,000,000 to get to 2 trillion. And that's to cover 2 million people. I mean, I'll take care of a person for $1 million. Hey, no problem. I'll give them all the attention they want. For $1 million, no sweat. I'll do it for 10 of them. We got it made. I've got a good friend who's a family practice doc. He would be thrilled. He'd take care of 100 of them for that price. And he'd have plenty of time left over. Let's go call him. See if we can do that. Oh, wait, no. We have to waste all of the money. Where? We have to waste it on insurance companies. We have to waste it on hospitals. We have to waste it on administrators. Oh, a little of it gets to doctors and to nurses. Most of it's going to hospitals, administrators, and good heavens, if we look at the amount of money we're talking about, over half of it's going into administrators somewhere. Now, let me ask a simple question. Are there any hospital administrators that take care of patients? Are there any clinic administrators that take care of patients? No, last time I checked, they shuffle paper. Oh, and they have the most expensive car in the doctor's parking lot. Now, let's look at another piece of information. We talked about $2 trillion for Medicaid. For Obamacare. Well, over the next 10 years, Medicaid's going to spend $5.5 trillion. If we were to use the clinic approach, we wouldn't need to spend any of that money. So not only would we save about $1.2 trillion from Obamacare, we'd save $5.5 trillion from Medicaid. There'd be no need for Medicaid. That's $6.7 trillion saved over 10 years. Do you think there's any way that we might be able to cut some taxes? Or do something else that might make this country more prosperous? If we quit spending all that money in Washington? Do you think you might be able to use a few of those dollars in your pocket? You know, that maybe they wouldn't take it out of your pocket next time? No, the bureaucrats obviously know better how to do it. And I'm sorry, you're just a civilian. You don't have all the knowledge. I'm sorry. Sorry I brought it up. Now, there is one little thing that maybe the government would do better, and that's the high-risk pools. We've talked about those before. It wouldn't take anywhere near $1 trillion to cover all of the people who have really, really bad circumstances and put them in high-risk pools. Those things could be handled easily. They can be done at a state level. And guess what? If we don't have this huge federal overhead, states could do it without any federal money. Oh, wait a minute. I forgot. The feds don't have any money. They take it from us. Think there's something that might be useful in this idea? Until next time, I'm Dr. Ted Noel. Thanks for listening.